I don't have a single highlight of the year, but what I do have is a number of highlights, and these are where I see a video, or I hear a story, or I speak to someone who has benefited from the improved services that we've been able to deliver through the efforts of the ICP.
Yeah, for us in the third sector, we're particularly interested in the work of the ICPs and the collaboration. People working together, looking at the whole person approach and the whole system approach to change. Whenever we work with individuals, we have to look at them in a collective. All the illnesses, all the things that make them, and through the ICPs we see that. We see they're actually looking at the whole system, trying to deal with people's problems as a whole, rather than individually. And we've seen some key programs that have made the changes. Programs like the social prescribing program that we're offering, where we can work with the GPs, work with the community and voluntary sector, work with the health service, and deliver people across that pathway to the program that suits them.
I've been involved with integrated care partnerships for 3 years, and what strikes me most is the integrated nature of the work that we do. We're working with patients, with carers, with community and voluntary sector, and also medical colleagues. And the determinants of health now are much wider than just the medical model, so it's very important that we work in an integrated fashion. We very much put patients at the heart of what we're doing, and the new models of care that we're delivering are delivered around the patient to try to get the best outcomes for our patients.
As a pharmacist involved in ICP, the highlight for me is really working in collaboration with my colleagues, be that GPs, hospital colleagues, patients and carers, and also members of the community and voluntary sector. And I'm delighted also to have the opportunity to work with council members moving forward.
For me, working in the ICP over the last few years has been that we have the right people in the room, and that's been the first time that that's happened in my 20 plus years working in the health service. So we have our community and voluntary sector representatives, patients and carers, consultant colleagues, nursing colleagues, social care colleagues, AHPs from the trust, and then GP and community pharmacy colleagues. So if we're going to improve care for patients and people and the population out there in our localities, we need that whole range of people around the table.
The Northern Ireland Ambulance Service have representatives on all the ICPs across Northern Ireland. The ICPs offer us a platform to engage with a range of stakeholders such as the trusts, the Health and Social Care Board, GPs, community and voluntary sector, etc. And through these networks, we can have developed a range of appropriate care pathways that offer our patients an alternative to go into the emergency department. This might mean an alternative destination such as a minor injury unit, or a frail elderly assessment centre, or an alcohol recovery centre. Or it may be that we refer patients to healthcare professionals in the community, such as the Falls team, or the community respiratory team, or diabetic nurse specialists.
I really do appreciate the work that's been done within the integrated care partnerships, because I do think that's where we want to be.